Hi, good afternoon. My name is Natalie Becker, and today we're going to be talking to Hannah Beachy. She is an acupuncturist, and she's going to share her knowledge and the types of things that she does with acupuncture and how it helps other people. And basically, this is all part of a series of talks and presentations that is geared towards trying to help women learn about ways to help their bodies stay well and help after if there is something bad that happens. Acupuncture is something that can help with the healing process. And through the journeys of different women and the art exhibit, it's about surviving breast cancer and thriving afterwards. And so she will be talking a little bit about that, but also a general wellness as well. Okay, Hannah, thank you for being here.
Thank you. Well, thanks everybody for coming today. I know we've had talks already about nutrition and different aspects of supporting during the breast cancer treatment process and recovery and just looking at prevention as well. But I think acupuncture can be a great tool for that, and I'm excited that we can be here and share that together. I don't know if any of you who here has had acupuncture? Two, awesome. And who here is a breast cancer survivor? I have a few. Awesome. I'm so glad you're here. So yeah, I think that often there are a lot of, there's some misconceptions about acupuncture, apprehensions about the needles, that kind of thing. So it's nice to have the opportunity to just talk about it, what it can do, break that down a little. We'll do some demos at the end to hopefully help you feel more comfortable, and you can see the needles, see what that looks like, experience it if you want. And also, I think a lot of times people just don't realize all the things that it can treat. So acupuncture is great for pain management, and that's most often, I think, what we're known for. But we also can treat just a huge realm of health concerns, and a lot of that just ranges from stress management through anxiety and depression and mood disorders, helping to regulate hormones. We do a lot of women's health in our clinic, from fertility treatments to prenatal care to menopause and just everything in between, and anything we can do to help regulate hormones and any symptoms that come along with that. And then, of course, we do treat pain. So that plays into a lot of different, I don't know, that can come along with any of these things that we're talking about. And then we help with sleep and digestion. So there are just a lot of aspects of health and allergies, so many things that we can help with and help the body be more resilient and help the body use its resources better. So it can kind of help at all different stages of the process. So we do have a lot of patients who come in who have had a recent cancer diagnosis of different kinds. We see that beginning phase of the journey is just extremely stressful. I mean, there's so much shock and trauma that comes along with that, and the C word, and trying to make sense of that. And each person is so different, and their treatment and recovery process is so different. And so the acupuncture can really help with that stress response and some of that feeling of shock, and helping the nervous system to settle. So that's a big part of what we do at the beginning. And then, of course, our patients are working closely with their doctors to come up with a treatment plan, figure out what works best for them. And as they go through that phase, those different phases of perhaps like surgery or chemo or radiation or a different, combinations of all of those, I think there are different ways that we can help. So we often see patients coming in with neuropathy related to chemotherapy, pain, or just like heat radiation. We can help calm that down. Sometimes I see people having, lymph issues, which is most often in the armpits, but, for different cancers, can be different areas, and we can help with some of that. And some people have more chronically after that can have lymphedema, issues with swelling because of those lymph nodes that have been removed. And we can really help with the circulation and the body recovering in that way as well. So we've seen a huge range. I think there's a lot of different ways that pain can crop up, and sometimes the cancer itself is painful or the recovery from surgery is painful, and so we can help manage that as well. And then just helping with like sleep and energy levels going through that whole process so that the body's recovering as quickly as it can between treatments. Yeah, there's a lot of ways that can show up. We used to treat people a lot for nausea during chemotherapy, and I don't find that as much in recent years. I think because we've had great advancements in the medications that can be used to treat nausea, people often go to that first and are able to manage it pretty easily. So that's not usually their primary concern coming in, but acupuncture definitely helps with that as well. So it's just, yeah, it's interesting. Each person and each journey is so individual, and we get to kind of meet them where they're at and keep checking in about what their symptoms are and what they need at that time. I think then people move into that, phase of recovery, hopefully. It's so exciting when they come in and have their first all clear scan and are like really excited. It's all that tentative excitement, and it's such a relief. And then, so we move into that phase of like long-term recovery, of like, what can we do to help manage stress long-term? Are there medications and hormone blockers that they need to be on? Each patient often struggles with that decision. What medications do I take? What's going to work for me? Do I take it for a while and now I don't feel good? And so we're just there each step of the way. Obviously they're primarily working with their oncologist, but we're there saying, well, we can help you manage your symptoms. We can help your body make the best use of the resources like the hormones that you do have, and cooling things down if there's menopausal symptoms that are coming out. Whatever it is, we adapt our treatment plans for that. So I think, yeah, it's interesting. It just depends on the person. It's so fun to share that joy in the process as they're recovering, and finding the next step, realizing that there's life beyond cancer and it keeps going, and what can we do now? Like, what does optimal health feel like now? And I think then we get back to sort of that place of like maintenance care, of just helping with stress management, helping with sleep, helping with calming the nervous system and regulating, again, just kind of regulating hormones, the whole part where we're supporting the whole body to just make the best use of its resources. And yeah, there's a lot of different pieces to that. I mean, definitely we love when our patients are working with a nutritionist. Sometimes we do nutritional counseling from that lens of Chinese medicine too. Sometimes we give people tools that they can use to treat themselves at home, that they can do maybe between their chemo treatments or some time when they aren't able to come into our office as often as they need to. So we'll give them moxa, which is like we have various tools of using moxa, but it's a way of stimulating the acupuncture points with heat, which is really fun. So they can do that at home. We give people instructions for what points to do to help boost their energy or help their digestion, whatever they need at that point in their treatment or recovery, so they can, have the support that they need. Yeah. I think there's just a wide range of what acupuncture can do. I don't know. Any questions so far or thoughts about? I just touched on a broad range of things, but yeah, Natalie.
So Hannah, where exactly do you do acupuncture exactly? Like, is it like for anxiety or things like that? Where are the common places
We treat?
Yeah.
Right. So acupuncture points are all over the body. And it's interesting because there's different ways to practice. So I think this is a good time to just talk about our clinic a little bit because it's different. So when you think of a classic acupuncture practice, you might think of going into a room where it's just you and the practitioner, and there's a massage table. You might be face up or face down. So they could do points on the back. They could do points body, chest, arms, legs. There's a lot of options. And so it kind of depends on who you're seeing and what they're focusing on. But in our clinic, we have a community acupuncture clinic. And so we treat in an open setting. We have an open room with recliners. Like right now, we have 5 recliners. It allows us to treat more people at once. Everybody's fully clothed for their treatments because it's just a different setting. And we're working on making it accessible for folks so they can come in as often as they need to. And so we do a sliding scale. We do a higher volume. For example, right now in our clinic, we charge 30 to 50 for a treatment. Then patients choose what they pay. And so it's just up to you. You pay what you can, and hopefully you can come in then as often as you need to. If there are acute symptoms, people often need to come in more than once a week. Sometimes they'll just come in once a week or every other week for maintenance. So there's a lot of, just depends on what's going on. And so in our clinic, because we have people clothed and they're in recliners, we're primarily doing distal points. These are the most powerful points in the body. It's where the acupuncture meridians come towards the surface. And so we've got really amazing points, but basically from the elbows down and knees down. So those lower arms and legs, those are the points we primarily rely on. That being said, we also do a lot around the neck and head. If there are particular areas that are affected, I'll often have my breast cancer patients, for example, come in with a tank top if they're having pain or heat in their chest from having radiation, or maybe there's scar tissue from a surgery that they want to work on. We will actually have them come in a tank top, and we can needle kind of around that area and access those points. For a more general treatment where we're working on stress or anxiety, we're probably going to put a few points in each lower arm and leg, and then some around the neck and head. There are some points in the ear that we really love. So I do those a lot for anxiety. And there's a protocol we do for PTSD that is actually just so versatile. So we'll use it a lot for insomnia, anxiety, if people are having any kind of nightmares or just feeling really like stirred up, like their nervous system just can't settle, like they feel like they're revving a little high, right? And those points will really help people settle down. If they're too intense, like if somebody's really sensitive to the needles, we have seeds that we can put on. So it's a little seed on a Band-Aid. It just does a pressure point instead. So yeah, so we have a lot of options. So I really tailor each treatment to the individual patient. If they come in and all the points are really sensitive, and this can totally vary from day to day. It might not just be person to person. It could just be how you feel today, right? So each point, if you barely feel them, great. That's the most common response, and we'll put some points in the arms and legs, around the neck and head, ears, let you relax for a while. If you're finding that each point is really sensitive going in, or you just feel really jumpy that day, we'll do a minimal amount of needles and we'll do seeds in the ears. Typically when somebody is feeling that sensitive, then a small amount of input still goes a long way. So we find that those treatments are still really effective. And the nice thing about the seeds, you can keep them in for a couple days. So it gives you kind of a sustained treatment. Some people love that. They're like, when I go to sleep and I'm just still feeling restless and I'm pushing on those points, and then I can fall asleep easier. That kind of thing. So we have a lot of flexibility in how we do it. And again, with the moxa, that's another fun thing. So we'll sometimes give people that option to treat themselves at home with the heat. It's sort of like a little incense stick, and you light it. We've got a little stick-on one, so you stick it onto the point, let it burn down. It just warms up the point, and it's a different way of touching in to, activate those points without needles. So it's nice having a lot of options. It's not just about needles.
Okay.
Yeah, that's what I mean. Needles is primarily what we do with most of our patients, but it's not just about that. Yeah, so there's a lot of options. Yes, please. Yes, totally. It varies a lot. So if somebody has hip pain and I'm needling their hip, then I can, that's an area of muscle that's about this thick. Go in pretty far. The vast majority of our points are very superficial. So we're just tapping them in, and it is, like a millimeter maybe that they go in or two. And the needles are so fine. Like typically we think of a hypodermic syringe when we think of needles, because we're used to getting our vaccines or blood draws or whatever. Those needles are so thick you can actually fit dozens of acupuncture needles inside of them. Ours are more like, they're a filiform, like a fine filament. It's almost like a hair or a thread. It's just very, very small. So that's why, fortunately, they're comfortable to rest with them in. Like we're very clear in our clinic, we do not like you to be uncomfortable during your treatment. So we'll place the needles, and if something hurts, we'll take it out or adjust it. And our goal is for it to be comfortable. So typically what we're seeing is that people will feel like a tingly sensation or pressure where the needles are, almost like it feels like somebody's there pressing that point, but it shouldn't be painful at all. So like most of our patients take a nap. That's part of what's so like rejuvenating about it, is you sort of go into this meditative place, sort of a sleep zone. Sometimes people start snoring. Yeah, I love it.
I came to her in a state of total anxiety, and I was one of those people that she could kind of barely put the needles in. Like, I would feel it sometimes, and she would do a lot of kneading, and I've gotten on the seeds
Yeah.
for years. And I think that it's the more stressed you are, and then the more anxious you are about the whole process, the more that tends to happen. And then I found that the days that I was more just relaxed and more open-minded to the whole experience. Like if I went there and I wasn't super stressed and I wasn't in a hurry, if I actually blocked out the right amount of time and it wasn't a very rushed thing, then everything kind of settles
easier.
Easier. You don't feel it as much. So like what you were saying, the day to day, that's very true. Like some days it would you feel it, and some days you don't. Like I feel like I don't feel it at all anymore.
Yeah.
Like I'm relaxed, and I look at it
Yeah.
as a massage now.
Yeah.
Like you can go
Right.
I feel like I'm
Rejuvenated, just kind of self-care.
than a massage. I'll fall asleep, and when I wake up, it's like I had a full body massage.
Oh, I love that. I love that.
Like remember when the needles popped out of my ears?
Sometimes they just, yeah. Yeah, it's so funny. Sometimes they go flying out again. Yeah. Yeah. Thank you. It's interesting. And I think it's important that we really understand that it, sorry, I just touched my mic, that it really does change for people every day. And it doesn't, you know, we don't take that personally. Like that's about what you're dealing with in your life and where your body's at. And it's not just that you can tell yourself, oh, relax, and you're going to relax. You know, there's more that we bring with us into the treatment room from our daily lives and where our nervous systems are at, maybe feeling really overstimulated with everything that we're dealing with. And so there will be days where that's just no big deal. And there will be days where everything feels pretty sensitive and it's vulnerable to come in and have needles put in, you know? And so we really play it by ear with each person and try to listen to that and give space for that. And I love, you know, just having practiced over time, seeing that it can be very effective with very few needles, very gentle techniques, or somebody may come in with muscle pain and they just really want me to needle the heck out of their, you know, some tight muscles, and we get in there and they feel better. And so there's just a big range of what's needed and what kind of put it into a dose of what the body can take in. Because it's really important that people are learning that our clinic or wherever they're receiving acupuncture is a safe place. I think there's a way that it becomes almost like the nervous system is trained. Like I'll have patients who come in and sit down, and if I don't get to them right away because I'm running a little late or they came early, they're falling asleep already because their body is so used to like, oh, I come here, I let everything go, and I get to rest. And it's like we you know, kind of, so the first treatment may not feel like that. We always want you to try it a couple of times. We don't suggest that if you know, if it's not a good experience, you keep coming and coming and coming. But it's really good to try acupuncture 2 or 3 times because your body will get more used to it and you'll start to drop into a deeper level of relaxation. And that can even start as you walk in the door because your body's like, oh, this is the place. This is the place where we get to let it all go and just kind of get to a different state that you could just describe as being that parasympathetic nervous system being very active and that sympathetic response just being very quiet. I think people feel it in different ways. So, yeah. Yeah, I should also mention we do Chinese herbs. That's a big part of Chinese medicine and most acupuncture practices. I just find that often with so like at our clinic, we have a full pharmacy with all different Chinese herbal products that can treat a wide range of things. But often with our cancer patients, their oncologists are so reticent to let them take any kind of supplements that, you know, if they don't know exactly what it is, they don't want you taking it. And we totally understand that. So we don't, you know, lean into that part of our practice much with our cancer patients. But it depends, you know, in recovery time, there's different things to take to boost the immune system or to help deal with some of the side effects of maybe those hormone blockers or, you know, insomnia or whatever is happening as a side effect. But that's just not our primary way of treating our patients when they're dealing with, you know, cancer and recovery. But it's also an option. And a lot of people I know will work with mushroom medicinals and do different things as part of their nutritional support when they're going through their treatment and recovery. So we support all of that. So, you know, it's not our primary thing that we do. What else? What else should we say about acupuncture? And I think all of us in our journey with our health, as we're learning what works for us, we just bring more awareness to that stress response in the body and the conditions in the body that creates, where it's easier to have a wide variety of illnesses. And so just that's that piece that we can start to, not that we can control everything about it at all, but we can really start to have a different set point of where our nervous system is running. And I think the acupuncture is just can be a really helpful tool to getting the nervous system to settle down and change that stress response, and thereby really change the conditions for health in the whole body. But there's a lot of tools, right? We need all the tools. So that's why I'm so glad you've had all the talks, the nutrition and the yoga, and there's just so many different angles we can have to treating it. So, yeah.
Hannah, thank you so much for being here. And what we're going to do is she's going to actually do some demos for us. And people that are willing and interested, we will be talking about yin yoga and its helpful role as well in with the nervous system, things you can do on a daily basis to stay well.